In this short video we are going to look at the basics of the aseptic non-touch technique, or ANTT. This is a generic lecture to give you the principles behind what we do and why we do it. There is no single way of performing ANTT, and practice and policy will vary with time, equipment used, between hospitals and even within different areas of a hospital. You must follow the policy in the area you are working when performing any procedure in clinical practice. Please note that our medical students should only perform ANTT procedures under supervision. The principles behind ANTT are as follows. There are certain key parts on invasive medical devices that are inserted into a patient. There are key parts on other devices that are connected to them. There are key parts where syringes may be attached to devices in order to deliver drugs. If a key part such as a port is uncovered or exposed, then it should be cleaned thoroughly before use. The aim of the process is to prevent contamination of these key parts, through contact with you, or anything else non-sterile. In order to be able to wash your hands and wrists properly, you should be bare below the elbows. This means sleeves rolled up, no wrist watches and no bracelets in clinical areas. A single ring with no stone is normally permitted, except during complicated procedures such as surgery. Ties are not usually worn in clinical areas. Before starting any preparation, hands should be washed with soap and water, since this will kill any microorganisms that alcohol alone may not. Hands should always be washed using the 7-step process. Palm to palm, interlaced fingers, back of hands, interlocking fingers, fingertips to palm, thumbs, wrists, clothing can be a great source of infection, so an apron should be used, which will also protect clothing from any unwanted splashes. The top of any preparation area and the tray for equipment should both be cleaned thoroughly with a 70% isopropyl solution, such as the red Sani cloth 70 wipes, and allowed to dry. If either are visibly dirty, then they should be cleaned with detergent and water first. Equipment should be gathered, and as you have been cleaning, hands washed with alcohol gel. Before equipment is placed into the tray, any key parts should be identified and ensure that they are protected from coming into contact with anything. This may require the assembly of 2 items, such as the ports of a needle and syringe. As long as key parts are protected, it is okay to place essential non-sterile equipment inside the tray alongside them. Once the preparation process is complete, any gloves should be removed and hands washed before leaving the preparation area. At the patient's bedside, hands must be washed, along with environmental cleaning. Washing hands immediately before and after patient contact may be our best defense against cross-infection. Well-fitting gloves should be worn for ANTT procedures. Skin and hubs or ports should be cleaned using a chlorhexidine in isopropyl solution for 20 to 30 seconds, and allowed to dry. We use the blue Sani cloth CHG 2% for venipuncture, subcut or IM injections, and to clean any ports or hubs. Chloroprephrent wipes are used for cannulation, blood cultures and ABG sampling. If the patient has an allergy to chlorhexidine, then a red Sani cloth 70 can be used instead. All sharps must go into a sharps bin immediately following their use, even if they have safety devices fitted. Once the procedure is complete, dispose of any waste. The bags and bins used may vary depending on the type of waste. If you are in doubt, ask. Aprons and gloves should be removed, hands washed, and the tray washed with detergent and water and dried for storage. More specific details on the process of ANTT can be found on each of our procedural videos.